My name is Patricia Kuszler. I'm a professor at the University of Washington School of Law. At the School of Law, I direct our Health Law LL.M and our Masters of Jurisprudence program. The answer to that is generally yes. Certainly that is true of private employers. As a private employer, you can require your employees to be vaccinated. Their option is then either not to work for you or to be vaccinated. There's considerably less clarity with respect to public employers. So you may need enabling state or federal law to be able to mandatorily vaccinate a government employee. There are three basic exemptions for vaccines. One is a medical exemption. This is generally attested to by the physician. Usually this is a case where an individual has a medical condition that would make it dangerous for them to have the vaccine. The second is a religious exemption. These vary quite substantially across states in terms of how much documentation the individual has to have to exercise their religious exemption. Sometimes this is clear by their religious tenets. The third major arena of vaccine exemption is philosophical exemptions. These have been instituted across many states, most states, over the last 25 years, and they had been articulated quite broadly, where the individual will just have to say, I don't believe in vaccinations, as they drop their 5-year-old off at kindergarten with no vaccination. That has changed over the last decade with the reemergence of infectious disease like whooping cough, measles, chickenpox. And now we're seeing philosophical exemptions become somewhat more constrained. Now we have in Washington a requirement that a philosophical exemption must also have a visit to the physician for the patient to understand what the implications of that exemption are. This, of course, speaks to the issue of whether or not someone can jump ahead in the line because they have a greater financial resources or greater power. Unfortunately, we've already seen this occur. This is something that should be discouraged, obviously, because this vaccine is supposed to be delivered to the individuals in a specific order to give us the fastest road to herd immunity and the fastest road to decrease mortality and morbidity from this coronavirus. The answer to that is probably yes, but it depends on whether there's enabling legislation to do that. So we may need state legislation to place coronavirus on the list of infectious diseases in which vaccination is required before a student is allowed to go to a public school. There's a little bit more latitude in terms of public officials and the state or the federal government restricting access to public buildings. It remains to be seen exactly how our legislature will interpret the idea of having mandatory vaccination for COVID-19. Assuming, as we hope, that this highly transmissible version is also susceptible to current vaccines, the goal would be to get mass vaccination as quickly as possible to decrease transmission of this potentially fatal infectious disease.